August is National Breastfeeding Month, a time to raise awareness about the health benefits, challenges, and support available for breastfeeding families. Today, we're joined by Andrea Ippolito, CEO and founder of Simplifed, to talk about how to support moms and their breastfeeding journeys. Welcome. Thank you so much for being here.
Thanks for having me.
Of course. So it's Breastfeeding Awareness Month. What are some of the things that are most important right now for nursing mothers and babies?
So right now, unfortunately, we are in a maternal health care crisis, especially in the postpartum period. There's this gap in care and moms feel alone. I'm one of them. I've had 3 daughters. And what we're seeing is doubling rates of preeclampsia. We're seeing doubling rates of maternal mental health. But here's the good news, that under federal law, health plans are required to cover breastfeeding support. And care pathways from providers like Simplifed can help work with moms, especially in the postpartum period where there's this gap in care. And we provide baby feeding support to navigate all the twists and turns of feeding. And along the way, we're identifying any other issues. We're doing maternal mental health screening as an example. So we can really identify issues before they escalate even further.
And we need to say this one more time. It's covered by insurance.
At no cost to you.
Everybody knows that.
Giant
because
PSA.
If we knew that, we would try to take more advantage of it, because you're right, we're not getting the care we need there. Talk to me more about Simplifed and again, how this care is free for patients.
Well, thanks so much for raising awareness of this. So Simplifed is a maternal care at home platform that's centered on our core offering of virtual breastfeeding and baby feeding support. And as you said, it's fully covered starting during pregnancy at no cost to families, no copay. And we start working with families during pregnancy to help make a plan for baby feeding, no matter how you choose to feed. And then we help work with families after baby's born to navigate latching, positioning, combo feeding, pumping, how to select the right pump for you, how to get size for your pump. They're a medical device after all. Sleeping and feeding, transitioning back to work, whatever that looks like to parents. And it's fully covered by commercial, Medicaid, and TRICARE health plans across the U.S. at no cost to you.
This is everything. I wish I knew about this, honestly. I don't think you and I are alone in saying that many women just simply suffer when you have that baby and then you're having these issues. There's a lot going on. There's a lot you don't know, and maybe no one's telling you, and you just don't know there's resources, but now we know there is. Now, Simplifed also launched the first ever National Mastitis Awareness Day. Talk to me about that and what it entails.
So to the point about suffering, 1 in 3 moms right now are impacted by mastitis throughout their baby feeding journey. And by the way, this costs health plans $1,000 on average. But a lot of moms say this is the second most painful thing that happens to them after birth. And I know I had it with my kiddos, and it's brutal. Yes. And it starts as a clogged milk duct, and then it can escalate very quickly into an infection. And this is one of the main reasons why families are presenting back to the ER or get re-hospitalized after baby's born. And so we need to spread awareness of this, because providers like Simplifed can help proactively navigate through it so it shouldn't even happen. It's completely preventable.
Yes, that's the biggest thing, preventable. So we need to get on the resources to know how to prevent it to begin with. Why do you think breastfeeding support is not just an everyday part of like a clinical specialty for women?
Yeah, well, one of the things we like to raise awareness that it is a clinical specialty. There are board certified health professionals. It's fully covered by insurance. There are reimbursement codes. It's also not just philanthropy. For health plans, it can save them money. For every $1 they spend on breastfeeding support, they get $3 back. And so we think there's not enough awareness about it because it is a newer specialty and there's been a lack of evidence-based data on it. But the good news is we have that data now. We know it's vital, and we know that insurance covered support matters. And so that's why providers like Simplifed are here to help navigate all the twists and turns of baby feeding, because it is your health. It's tied to your baby's health, your physical health, and your mental health. Excellent.
Where can people, anyone who's listening or they know someone who's about to have a baby, where can they go to find more information?
They can go to our website, www.simplyfed.com, and you can click on the Start Getting Care, and then we can make sure your insurance covers it and start getting you connected to care during pregnancy and throughout your postpartum experience.
I love it. Andrea, where were you when I was having babies? I needed you then, but I'm so glad everybody can hear this now. Thank you so much for being here.
I appreciate you raising awareness of this.
Of course. You can check them out again at simplyfed.com.